Okay, I want to talk a little bit about some really exciting research, and I think the last video I was talking about kind of the failure of certain kinds of research, the failure of us taking vitamin C to make you live longer, the failure of us giving you a tablet or a supplement to make you healthier. And those research topics in general have not gone well for the scientists that have tried them. And we've spent millions of dollars in those kind of trials, and they haven't worked out well. But there is an area of longevity and health research which has been persistently and repeatedly positive. And this is trials of using a special technique to increase health, protect against cancer, heart attack, and stroke. And every single study in every kind of animal tested shows over and over again that this particular treatment is effective. It's effective in mosquitoes and flies and rats and bats and cats, and most recently in our closest relative, in chimpanzees and primates. Okay, vitamins don't work very well, but one therapy has routinely been tremendously successful. It's called calorie restriction. Calorie restriction. That's simply meaning eat less. If you take a group of mice and let them eat what they want, and in the next box, calculate in grams or pounds, however much in ounces they ate yesterday, and give the other group, the therapy group, 30 to 70% less food, they will live 30 to 70% longer. Less calories in compared to what our natural inclination is means a much longer life, much lower risk of cancer, much lower incidence of heart attack and stroke and hardening of the arteries. Just eat less leads to a tremendous increase in health. And most recent exciting news is people were skeptical that this would work in human beings, that we would be able to eat less and live longer. So about 15 years ago, they started a trial in monkeys, the closest relatives to us, and in a closed system in orangutans or chimpanzees in a primate center in Chicago, they have been treating two groups of animals very similar to us, the kind of the primates close to us, with either an ad lib or a regular diet, eating what they wanted, or a diet that was a calorie restricted diet. And the research is now coming out 20 years later. They have photographs of the animals and things like that, and you can see fewer wrinkles in the skin, less osteoporosis, less hardening of the arteries, less cancer, all these changes that we see. Calorie restriction saves lives, protects against cancer and heart disease, and calorie restriction is what you get with the MGB. So exciting new research. We're really excited about it, and it suggests that the kind of the idea for our patients long term is going to be one of tremendous health benefit. So if you're looking into this and you want to Google it, you can look at what we call calorie restriction on the internet. Look at some of the latest research. It's very exciting, because what happens to our patients is they eat less. And the percentage that they eat, we'll ask some of our patients in a minute when I finish the video, is somewhere between 50 to 70% less food, and that's associated with a much longer, much healthier life. So we're excited to kind of report some of that news this morning. Yeah?
Question maybe a little bit off topic with it, because it's not just about our education, but for our kids and stuff. But for my child who I want to grow up never having to deal with that, having a long-term effects, how would that? How can I incorporate that for them for different age groups with calorie restriction? Is there research showing, hey, this amount of calories for a boy age 6 to 8 or 8 to 10 would be beneficial? Is information enough out there yet?
Wouldn't that be great if I had the answer to that question?
Yes, it'd be fantastic.
Yeah, I think we could all kind of split up the millions we would make with that this morning and blow town and go see a show or something like that, because I wish we did have that answer. Because the bottom line is, there's no question, all of us in America in general should be eating less fat, less calories, and eating healthier. How do we do that? I wish I had that answer. I do not have that answer. I don't like the fact that right now the best answer we have is this major invasive surgery. And so if there was a way around that, a solution like eat more fiber,
Right.
exercise more, eat less, and I bet you've never heard this one. Why don't we eat less and exercise more? Oh, heard that one before? Yeah. So I don't think that advice, although it's kind of common sense, by itself works. And so maybe we could talk about that for a second. Actually, my